All holding chambers are not interchangeable. There are several factors to consider in recommending a specific holding chamber for your formulary or in selecting a holding chamber for a particular patient. Specific holding chambers and their features may change over time. So, rather than discussing specific devices, we will discuss the various features and their relative importance. Let's start with some critical features. A holding chamber should be specifically designed for use or at least tested with HFA inhalers. The holding chamber needs to be able to accommodate the width of the HFA plume. If the holding chamber is too narrow, part of the drug plume could hit and deposit on the holding chamber walls. This would make less of the drug available to be inhaled. Most holding chambers were originally designed for chlorofluorocarbon, or CFC inhalers. HFA inhalers generally have a wider, slower plume than discontinued CFC inhalers. So, older holding chambers should be restudied with the new HFA inhalers. Not all HFA inhalers have the same plume size or speed, so ideally a holding chamber should be tested with the specific brand of metered dose inhaler. Drug delivery to the lungs may vary based on the specific combination of holding chamber and MDI. The next issue with holding chambers deals with electrostatic buildup. A holding chamber designed to prevent electrostatic buildup may increase the drug output from a holding chamber by 20 to 80%. If the holding chamber does not have an anti-static feature, leaving a detergent film when cleaning the holding chamber has been recommended. However, in studies, the detergent film was not as effective as a non-electrostatic holding chamber. Thus, a holding chamber with a non-electrostatic feature is definitely preferred. The connector of the holding chamber should be compatible with the mouthpiece of the inhaler. The connector of the holding chamber should form a tight seal around the mouthpiece when the inhaler is inserted. If the holding chamber and the mouthpiece of the inhaler are different shapes, the drug might leak out the back of the holding chamber. For example, the mouthpiece is round and the holding chamber connector is oblong. In choosing a holding chamber to carry in your pharmacy or to place on your formulary, look for one with compatibility data on a wide range of HFA inhalers. Specifically, look for one that has data for inhalers or your formulary or most commonly dispensed in your pharmacy. There are additional features for holding chambers which may be desirable. The first feature we'll discuss are latex-free devices. Some patients with asthma have latex as an asthma trigger. Also, some healthcare professionals can develop latex sensitivity over time. So, having a device without latex is a nice feature. The next is a one-way valve. This valve can be helpful for those who struggle with hand-to-lung coordination. One study showed that drug delivery from holding chambers may be greater than from spacing devices, which do not have a one-way valve. Some holding chambers have a signal that indicates a rapid inspiratory rate. A fast inspiratory flow rate increases the amount of the drug deposited in the mouth and throat. Some holding chambers come with a whistle that will sound if the inspiratory rate is too rapid. This signal can be helpful to patients who are just learning and assist to keeping the correct inspiratory rate over time. Another feature to consider is cost. Obviously, one needs to take into account the initial cost of this device. In considering cost, one should also reflect on the durability of the device and the likely frequency of replacing it over time. Finally, convenience is a factor with two things to consider. The first is cleaning. Some holding chambers may be easier to take apart and correctly reassemble for periodic cleaning than others. The portability of the device should also be considered. Larger devices may be bulky for carrying in a purse or a backpack.